Thank you so much for coming on board and accepting our accepting our invitation coming around. So we wanted to hear your journey, especially that initiative what you have done, 1 rupee medical support which you are trying to establish, and also a little bit journey, like how did you got the idea first of all, and so we'd love to hear that, and what are the initial hurdles to begin that. So that will really help us. And based on that, our team already framed some questions, and they will be continuing for the second, third, and fourth question. Thank you very much.
So I was born in Lucknow, and I did my schooling from City Montessori School there, and then I did my bachelor's in electronics and communication from IIT Roorkee. Then I went to the US, did product development in IBM in Research Triangle Park, and after that I got my MBA from Cornell and returned to IBM. They were processing my green card. I returned to IBM and did product management, channels, and go-to-market work there. Then I co-founded my first company, which was a cloud-based mobile technology company. And while running that, there was an episode with my mom, which almost took her life. She was misdiagnosed and almost lost her life because of hepatitis C. Luckily, in Delhi, the correct diagnosis happened, and then she responded to treatment, and she is healthy today. So this led to the realization that if situation in Lucknow was so bad and there were so many medical errors, the situation in Tier 3 and rural would be even worse. And so we started a B2C for primary healthcare on a subscription model in rural areas, two areas, Kakori and Maliabad, which are in the Mango Belt. And there we were offering this on 100 rupees per family subscription. Per family of 5. And very quickly we realized that the B2C model would not scale and would require a lot of capital. So we switched to a B2B model, and the B2B model clicked out for us. Initially, it was a general health technology-enabled general health service, and our customers were employers and school. And then we had another epiphany where we realized that we could increase our average revenue per user if we started doing more specialized services and procedures. So we split our service into general health, vision, nutrition, cardiometabolic, and infectious disease, and that helped us increase our gross margins and achieve unit economics. So 2-3 years into the journey, we received one more request from our customers, and they said, while your mobile clinics are good, we do want some medical advice and some medical help between mobile clinic visits. And so we added telehealth services to provide access to care when our mobile clinics were not present on site. And 3-4 years ago, we made another interesting twist. We started dabbling with AI, and the immediate reason for doing that was we were doing a lot of consultations with malnutrition. As you know, malnutrition is one of the top disease areas in low-income populations, and dietitians are pretty hard to come by, and often where they are available, they're expensive. And so we developed a diet AI, which enables a nurse to do a dietitian level recommendation and predict multivitamin and mineral deficiency. Then we developed our Speedum AI, which could enables the nurse to screen for tuberculosis. We developed our Vision AI, which reduced the need for ophthalmologists for screening purposes and could screen for diabetic retinopathy and cataract. And recently we deployed our Symptoms AI, which enables a nurse to do a physician level initial triage and consultation. So by doing this, one, we increased access to care in low resource settings, and two, reduced the own cost of delivery for primary healthcare in these areas by up to 50%. And so today we provide AI-assisted disease management platform to organizations in 20 plus states of India. When we say a state, not only do we mean Tier 1 and Tier 2, we especially mean Tier 3 and rural. We are doing around 72,000 plus patient consults per month. We have done to date 3 million plus consultations via 254 full and part-time medical teams in these states. 245 customers, B2B customers, are paying for our services in these areas, and we have also done pilots in Southern Africa and in the US market. So that's a quick brief about how we arrived where we are and what we're doing.
I think since you are initially already started as a tech cloud, understood the aggregation process, and I think you're able to bring that entire thought process. I think that's great. That's great to hear. And also, I'm interested in the other thing is Seva Mob. Is it a Seva Mobile or it's a Seva Mobilization? I was curious to understand even name tag what you have done.
Sure.
Yeah.
Mob is for mobile and Seva is service through mobile. So initially it was a standard service using the help of we have a patient data management and analytics platform. So initially that's how that was the mobile component in it. It could operate fully offline in a low resource setting. And then the same was extended to telehealth services. And then finally when we added AI, again that extension of mobile happened.
Thanks so much. Short and sweet.
Thanks, Ali. I'm very happy to hear more about your journey.
Sure.
I think in a nutshell, you have explained everything about your overview of your journey, right?
Yeah.
So, the next question. What motivated you to pursue a career in project management and entrepreneurship?
So I think I already covered that in the initial answer, where when I was working at IBM, I had all these ideas. And IBM being a large organization moved at its own pace. Those ideas stayed in the head and they were daring to come out. And so that was initial impetus to do the cloud-based mobile technology company, where I implemented a lot of those ideas, which I could not implement in IBM. And then I already gave you the impetus for doing this company SevaMom and the episode with my mom. So those were the two reasons how I got into entrepreneurship.
What was your most effective marketing campaign?
Campaign, right? Marketing campaign. Yeah. So this being a social impact enterprise, we are blessed with getting a lot of free PR, a lot of free interviews. So I would say the biggest help has been all along through this journey. A lot of media agencies, a lot of other type of agencies have interviewed us, whether it's podcast or video interviews or in-person interviews, or just articles. So we have received plenty of coverage throughout our journey, and that has been free coverage, which is always appreciated. Then another thing which helped us in getting the word out was we participated on a reality TV show on NDTV, The Real. And so that was a 10 episode show like Apprentice, and that helped in getting the word out also. Then further, we received 3 rounds of equity investment. So those impact investors highlight their investees in their newsletters. So that helped us again with the investor community and with other entrepreneurs. Then we participated in a number of accelerators, and those accelerators helped us in getting the awareness about SevaMom also. Then we also published a lot of white papers and journal papers. So in the medical community, that's how we got the word out. So I would say those are some of the ways in which there was general awareness. Then for in terms of acquiring the customers, we have 2 main marketing campaigns. One is a more of a high-touch B2B marketing campaign, which is more relationship-based. And second is a low-touch marketing campaign done by LinkedIn and email-driven. And so those are all the ways we have done marketing.
That's so nice. Finish very good.
Yeah, I would like to know, how do you develop and manage your product roadmap?
Sure. The product roadmaps are done in a number of ways. So first of all, we have our own internal strategy sessions in which we brainstorm between myself and our CMO, Chief Medical Officer, and our Chief Technology Officer. We brainstorm and we come up with new concepts, and that's one way. But the biggest input in the product roadmaps is from the customers and the end user. So as I described earlier, the reason we developed the Diet AI is because around 20% of our consults are malnutrition. So that learning from the market helps us develop new ideas. Same way, vision is another 15 to 20% of our consults. So again, the market taught us to do vision. Symptoms AI was needed because we do a lot of consultations, and if we do this initial triaging with the nurses, then that helps reduce the workload on the physicians. Telehealth again was a requirement from our customers. So I would say it's a mix of internal concept development, but the bigger piece is the market learning.
You utilize technology very well in these scenarios. So how do you find and seize new business opportunities in different regions? Because region to region it varies.
Yes. So new business opportunities, I would say the biggest source has been word of mouth and referrals. Our existing customers refer us for to other customers. And that's always the lowest cost customer acquisition model. If your existing customers are happy with what you're doing and they buy. Then the second source, as I mentioned earlier, as a B2B high touch sales model, where we have sales staff and that has developed relationships with them. Then we have also run B2B low touch marketing campaigns using email and LinkedIn, and that have been the source of some opportunities also. So those are the three main ways, but the biggest bucket. And then finally we also use the government GEM portal, which through which we participate in a number of tenders for the government.
So in this scenario, how do you handle budgeting and managing PL to ensure a project or company's financial health?
So budgeting is done at two levels. So one is at the project level and the other is at the company level. At the project level, we create a budget on a cost plus margin basis. In some cases, we also do value-based budgeting. So based upon the requirements discussed with the customer, so we have certain standard protocols. The customer chooses from that menu which protocols are of interest to them, and accordingly the budget is generated based upon that. And then normally the customers start with a small proof of concept or a pilot, and then over time that develops into a full bigger deployment. And then at the company level, we do annual planning at the end of the financial year closing, and in that we estimate what type of capital is needed, how much of that capital is needed, what are the sources through which we could get that cap, and also what we do need to do in terms of is revenue growth the target for the next 12 months, or is profit margins the target for the next 12 months for each, because whether it's revenue growth or profit margin, the approach is slightly different. So in one case, cost cutting might be like.
So can you give an example of how you reduce the operational cost without losing the quality or?
Sure. So the biggest use there is of technology, and especially the AI component helps us reduce the need for specialists in the initial consultation. That helps us reduce the need, the cost. So for example, if we were doing a malnutrition intervention with a dietitian, that would cost us around 2,500 rupees per day for dietitian. But if we do the same protocols with our nurse plus diet AI, we can do the same thing at roughly 67% lower cost. So that's one way you reduce the cost without affecting the quality. The way is where as you achieve the economies of scale, you start getting some cost benefit. So for example, the point of care kits that we procure now, because of our procurement volumes are cheaper than they would have been otherwise. Same way, the medicines that we procure, they are again cheaper. As you know, the greater your order volume, the better this thing, right? Same way, another way to lower the is the business model itself. So for example, if I had to set up physical clinics in 20 states of India, I had to set up 245 of these, 254 of these, then it will be very hard to manage the quality. On the other hand, and they would be able to reach out to a much lower target population, because each fixed clinic gets patients from 3 to 5 kilometer radius at the most. Whereas a mobile clinic, you require first of all fewer staff to target patients in the same district, to serve patients, and you have to train fewer headcounts also, right? Because now that same 3 headcounts or 2 or 4 headcounts can serve a much larger catchment area. So your business model also is very critical, and think about it from now.
Okay, thank you. So overall, what methods do you use to ensure continuous improvement and innovation in your process, this kind of vast experience?
I think we have addressed that question from several different angles. I have nothing new to add.
Maybe the main bullet points.
The top one is market learning. The top 3 bullet points. Yeah.
Good.
Feedback from the customer.
Nice one.
So can you just throw some light on the collaboration? How do we see a long way to collaborate?
Sure. So we have a couple of different levels of partnerships with the customer, with the partners. One example is Swasti out of Bangalore. Now, Swasti out of Bangalore, they are established NGO in India and outside India also. And they started one new program for factory workers. And we have been working with them across several interventions for the last, I would say, 5 to 6 years. And so when they started this intervention, they already knew our capabilities to deploy medical interventions across India, and quickly those interventions with a good enough quality. So in that scenario, Swasti acquires the customers, Swasti manages the relationship with the customers, and we are the last mile implementer for those customers that they acquire. So that is one way of doing this relationship, where if say you are doing customer acquisition, part of the value is delivered by you, and the medical expertise comes from us. That's number one. Number two, where we become like a subcontractor in that relationship. Number two is where it's a straight reseller relationship, where you just take our service, our products as is, and then you resell them to any type of customer. There the value that you are adding is pretty much the sales value only, nothing beyond that. In case of Swasti, it's also in project management and things like that. But in this scenario, the second scenario, it is just a simple reseller relationship where you are using your own. In this, we have two options for this relationship. One would be we do a simple revenue share with the reseller. Typically, that revenue share is around 10% of revenue for most contracts, and we can develop a tiered model. The other is where you take the service from us at a set price, and then you resell at whatever price that you want. So, for example, if you think that you can sell a 10 rupees service for 30 rupees, go ahead and sell that at that price in the market. So, reseller relationship is the second option. Then, in the past, we've also used the franchisee option, especially we use franchisee option for Southern Africa. So those are three levels of relationship, and based upon where you are in the market and what your strategic objectives are, we will be happy to talk to you.
Lovely. Actually, you by chance, any Uday Agrawal from South, from Hyderabad?
We work a lot in Andhra Pradesh and Karnataka and Tamil Nadu. So not sure if they know our zonal managers there, but I myself do not.
Because I think he was the one who just put me in my mind somebody from UP, and he's doing wonderful job on the UP, and that's what it was. Thank you so much. I'm
Sure.
just looking, and you can. I'm so happy for a short while, in a very short notice, you're able to accept our invitation.
Yeah,
Thank you so much, Mr. Shelly. My name is Hannah. So here
Hi.
I'm here to ask you your personal attributes and your future goals. So what personal quality do you believe have contributed most of your professional success?
The ability to pivot, learn from the market and pivot is the biggest quality, and not give up. Keep learning and keep pivoting until you arrive at the right solution. I would say is the biggest quality in an entrepreneur.
That's absolutely wonderful. And where do you see yourself in the next 5 years, and what steps are you taking to achieve those goals?
In the next 5 years, the problems which we are solving, so our mission is to fundamentally transform the delivery of primary healthcare in the world. So the problems which we are solving currently in Asia, in India, we would like to address those problems throughout Asia and Sub-Saharan Africa. So I would say that's where we will be in the next 5 years, doing this not only in India, but in South Asia, Southeast Asia, and Sub-Saharan Africa.
That's
I
wonderful. All the very best
Thank you,
Yes.
guys.
for future achievements. And
All right. Thanks again, for setting up this call.
Yeah. Thank you. Bye.
Thank you. Bye.
Thank you so much, Shelly, for sparing up your time.